So you interviewed 30 experts in 30 days.
I did. It was actually 36, but 30 and 30 sounded.
36 experts. Why did you do something that aggressive?
All right. So I am a big fan of Melinda Gates, and her philosophy is that if you want to help a group of people, you need to go to them and you need to understand what their environment is, what their needs are, in order to have the greatest impact. And so in this case, the environment would be the hospitals, the clinics, and the people are, of course, the patients and their families, but also the care providers. And so obviously it was very important to me and to SpellBound to understand what the needs are.
And what kind of people did you talk to figure that out?
It's kind of a wide range. When you think about what gets a kid moving, there are a lot of potential answers to that. I spoke to physical therapists, occupational therapists, child life specialists, nurses, and that was from staff nurses up to chief nursing officers. I spoke to patient technology experts as well as art curators. When you think about the environment plays a very important role for children. If they see something of interest, they're going to want to move to it. And so they really have a great role in that.
That's awesome. And I'm sure you learned a lot from this experience, but what are the 3 biggest takeaways?
All right. So I would say one is that I think kids are in really good shape because hospitals are really putting in efforts to increase mobility, and increased movement translates into positive health outcomes. Secondly, I would say, and this seems obvious but really deserves to be stated, it is very hard to get kids to move when they don't want to, especially when they're in pain. And then lastly, building this culture around movement is not fast. It takes time. It's a multidisciplinary effort. And fortunately, a lot of hospitals are engaging in that.
So what are you going to do with all this insight you gained?
All right, a few months ago, we began working on a product which is called Arise. The idea is that moment when you decide to get out of bed in the hospital. Arise is a digital scavenger hunt, and it provides a whole bunch of wow moments for kids. And so they want to go engage with their device at point A, point B, point C, and they want to start to move. We were able to get some really great feedback in order to inform our, Generation 2 version of Arise.
And can you tell me specifically, sort of talk about the genesis of Arise and how hospital staff help shape it?
Yeah, actually hospital staff really help shape it, because when you think about some of the tricks that nursing, that physical therapy, that child life specialists have to get kids moving, a lot of times it is these type of scavenger hunts, seek and find, find something interesting along the wall, find the Beanie Babies, just to get kids moving. There is no lack of creativity that some of these individuals have. For example, there was a child life specialist who mentioned with a patient that she allowed this person to throw chicken nuggets at them, just as an incentive to get them to move from there and back again. And, these people work day in and day out to get kids moving. And they have to keep coming up with new things constantly. This is really a tiring process. And so Arise evolved as a way to help those people who are constantly trying to come up with new ways to get kids moving.
And can you tell me a specific story about maybe just an example of how a child would interact with Arise?
Sure. All right, do you want to give me an example name of a child?
Sally.
Sally. Okay, Sally just had surgery. And it's very important, we know, that Sally needs to move. It's going to help her recover a lot faster. It's going to decrease her length of stay in the hospital. It's going to increase the likelihood that she's not going to have to come back to the hospital, right? And so Sally sees this funny little target over there, and she has her SpellBound app on either her mom's device or the hospital's device. She looks over the wall with the device and she sees this really crazy thing happening on her phone, and she can interact with her phone. It allows her to become a little bit more curious, and she wants to see what the other targets do along the hallway. And so Sally gets out of bed. So that's where this concept of a rise comes from, is that they rise from bed and they start to move and start to engage with these different digital experiences. And that's kind of the vision that we have and that we're building with some of our collaborators in hospitals across the country.
What outcomes are you targeting with Arise?
All right, so Arise is helping clinicians approach, I guess, all of the same outcomes that we would be talking about if we were talking about the effect that movement has on a patient's outcome. So reducing the amount of falls that happen in the hospital, reducing the amount of painkillers that are requested, also reducing length of stay, the amount of return visits to the hospital, and then finally the amount of hospital-acquired illnesses that one might have. So all of these things are things that movement has an impact on, and all of these things are ways that the Arise scavenger hunt can help optimize the experience and the outcomes for patients.
And it sounds like you guys are doing a lot, but where is Arise headed? What's the future of Arise?
Well, thankfully, because I spoke to all of these experts, they were able to inform me of other needs that exist within hospitals. I'll give you one example, and that is that often teens or early teens are kind of left in the dark. They have less offered to them in the hospitals, and so we are building essentially a level up version of Arise that will allow for engagement not only of a younger population but also of a teen population. We're trying to build experiences that are more inclusive and can help some of those that have been previously less targeted within hospitals.
Yeah. That's awesome. Thank you so much. I appreciate it. Where can people learn a little bit more about SpellBound and Arise?
So first of all, the SpellBound website is just SpellBoundAR.com. Arise, actually there is a blog post that recently came out, and so if you just go to www.spellboundar.com/blog, you can see one of the most recent posts about this.
Fantastic. Well, thank you so much for your time. I appreciate it very, very much, and thanks for the insight.
Of course.